Ghana Health Service, through its neglected tropical disease program, will be embarking on a nationwide mass drug administration to eliminate elephantiasis and onchocerciasis, also known as river blindness. This exercise will be done in about 125 districts across the country. Chief Biomedical Scientist Bright Alumatu joins me in the studio so we can have a quick chat on this. We'll also get to find out who are at risk and possibly take some advice on the disease. So we should be looking at with the onset of the rains. Mr. Alumatu, you're welcome.
Thank you very much.
Okay, good to have you. And I'm seeing some drugs already on the table. Yeah. You still have some box hiding there? What's in that box?
No, it's for this particular one.
That's it. Okay. Yeah. So elephantiasis, really, I remember when I was doing my national service way back somewhere in 2009 at GTV that I did a story about elephantiasis, and that is about the closest I've come to the word. I mean, does it still exist?
It still exists. The disease is endemic in 98 districts in Ghana. We mapped the disease in the late 90s, and then we started implementing a program to eliminate the disease from Ghana.
Okay.
We started from 2001, and we do annual mass treatments.
Okay.
Where we train volunteers who move from house to house in the endemic areas, and then they give out the medicines to the people, so the disease is still
So are there any statistics for us to at least know the sort of, what we're dealing with?
Yeah, for the disease, let me first say that it is transmitted by the mosquito. It's a kind of worm that lives in the blood, and the adults live in the lymphatic vessels. The mosquito bites and picks the parasite from an infected person. So it means that the mosquito is not born with the disease, but somebody must have the parasites in his blood, and then when the mosquito comes to feed, then it will pick some of the parasites, and then later on it will bite
someone else and transmit it to the which is really it's a really strange process, if you ask me, because how are you sure, how sure are you that a mosquito that bites you here can bite someone else, let's say in a circle, and give them a disease that they've picked up somewhere else?
Yes, you wouldn't know. And actually you also will not know who has the parasite or not, because what we know is that many of those that have the parasites don't show the disease early.
They don't show the disease.
It hides in you for many years before later on you start showing signs of the disease. Because,
how many years?
The earliest we've seen is 6 years. It can hide in you 20, 30, 40 years. So some people.
So we're talking about elephantiasis here.
Yes.
And that you can have for at least 6 years without noticing.
Without noticing.
Is there anything at all that you could pick up as a clue for you to have an idea that you have it?
It doesn't give you any other sign except when you go to the lab to be tested. And actually the parasites most often move in the blood at night. So most often we do night blood testing. So they collect the blood at night and then examine. And if you have the parasites, then you know that you have it. But apart from that, there is no other sign for you to see that you have the parasites. So they may hide in you for many years before you start seeing the disease. And
but then after 6 years,
yes,
you will be able to see some symptoms.
That is the earliest that we have seen.
The earliest.
Some people can even live with the parasite for the rest of their lives, but will not develop the signs of the manifestations of the disease. And these people can still continue spreading the disease. So we are different, and different people respond to the infection differently. Yes, and it takes a lot of time for the lymphatic vessels to be damaged. Actually, what happens is that the vessels carry the lymphatic fluid in us. So the circulation of the fluid happens within the lymphatic vessels. And the parasites go into the vessels and then damage it. So it gets to a point, the vessels become compromised. They are unable to perform their actions. And therefore, when the fluid descends to the affected part, it's unable to move around. So it is the full fluid that accumulates in the affected part that we see as the swelling.
And maybe our production team can maybe get us some visuals of elephantiasis. The ones that I have seen, you have people with very huge feet. I mean, sometimes, isn't it possible for you to see it when your feet become swollen at a point? Because it appears to me that people allow it to grow to a certain level where they can't do anything about it. Or can they do anything about it?
Yes, not that they allow it. And actually, those that have had such conditions will tell you how hard they fought, but they don't get the results that they desire.
Wow.
Yeah, because what happens is that the swelling starts gradually and is kind of progressive. But things that we need to do to stop the progression, the knowledge is not out there. It's one of the neglected diseases, yes. Yeah. And even during medical training for various professionals, the management of those conditions are not integrated into the kind of things that they are taught. So patients will go to various facilities, but the help that they actually require,
they're not getting the help.
So eventually it gets bigger and bigger and bigger. And actually, it doesn't only affect the legs.
Okay.
It can affect the hands. We also have elephantiasis of the breast. We have that of the penis. We have that of the scrotum. And apart from the elephantiasis of the scrotum, we also have the hydrocele. That one is the accumulation of fluid in the scrotum. So that one is very big, that the scientists call echo, or the others call evu.
Okay.
Yeah. So it affects many parts of the body. It doesn't kill, but it exacts so much deformity.
Yeah.
And it comes with so much stigmatization, social rejection, and many others.
Does it come with pain? Is that painful when you see those? So this is what scrotum, or it looks like the thigh. I'm not quite sure.
Yeah, it's the thigh.
It's the thigh.
It's the thigh. Yes.
So it can affect the thigh as well.
Yes, it can grow up to.
So it basically can grow in any part of the body.
Yes. So the parts that are hanging normally are those that are affected.
Those that are affected.
Yeah. So the limbs, that is the legs, the hands, the scrotum, the breast.
We'll talk about prevention to wrap up the conversation. But talk us through this project to that you're going to embark on to vaccinate people.
Yeah. Okay. Yeah. So there are two main diseases that we are fighting against at this particular time. We also have the onchocerciasis, or the river blindness, that the flies that transmit them, they are also transmitted by, it's also transmitted by the flies, the black flies. They breed in fast-flowing rivers. And the areas that we have the flies plenty, that is where you have a lot of people having it.
Which are these areas which I believe you're going to focus on?
Yes, they are in the 9 regions, except, I mean, they are in 9 of the 10 regions. Greater Accra is the only region that doesn't have onchocerciasis.
Doesn't have at all, or we don't have statistics, or we don't have evidence?
Yes, we've done a lot of research.
And it doesn't exist in Accra?
Yes, we don't have it in Greater Accra.
But then the remaining 9 regions have it. That's quite severe.
Yes, so a good number of districts have it. And apart from that, the elephantiasis is also found in 98 districts in 8 regions. So Volta and Ashanti regions, we don't find the prevalence to the level that is of public health importance that requires that we take an action. Yes, but doesn't mean that you may not find anybody in these regions having them. But largely we work in these areas.
Okay.
And what we do is that annually we give out these medicines to the people, so that, as I said, the parasites are picked from one person and given to the other. So what we do is that we give medicines to kill the parasites in us.
Okay, are these the medicines?
Yes, these are the medicines.
Okay, what's it called? Can I have a look at the box?
Yes, so this one is Mectizan, or ivermectin.
Mectizan, okay.
Yes.
And this is for both, or for?
This is for onco.
Okay,
and then
river blindness.
Yes, and it's also for elephantiasis, but for the elephantiasis we add albendazole.
Okay.
Yes. So
if you're treating elephantiasis, then you're going to, or for vaccination. Is it for the vaccination?
It's not for vaccination. It kills the parasites.
It kills the parasites.
Oh, yeah.
Okay. So you take the Mectizan plus albendazole.
Yes.
Albendazole. Okay.
Yeah. So the Mectizan is taken according to height. So you start from 1 to 4. Somebody may take 1 tablet, some 2, some 3, some 4. And then everybody that qualifies to take this also takes a tablet of albendazole for elephantiasis.
Okay.
And that if it's only onco that we have in that particular district, we give you the ivermectin.
Okay.
Yeah.
So you're giving this to people who already have it, or people who don't have it as a safeguard?
Anybody that lives in that area, that endemic area.
Okay.
We treat everybody, because we try to prevent people from getting it, because as I said, the parasites can be in many people. You wouldn't know.
You wouldn't know.
And we wouldn't be able to test everybody before giving out the medicine. So it's kind of preventive chemotherapy, where we target everybody that lives in an endemic area. We started initially on the onco with spraying of the areas that the flies breed in. So that one was to take away the insect that transmits. But that project was very expensive. It's also not easy to identify the areas that the flies breed. But later on, we got these medicines and we target the humans that we all live with. So that if we all take the medicines and the flies come to bite us, they will not get the parasite to pick and then give to
give to someone else. So is this is a Ministry of Health project?
Yes. So under the Ghana Health Service.
Under the Ghana Health Service. Yes. And who's funding it?
We have various funders, but the major funding group is the USAID through the FHI group. And then we also have the medicines donated by Medicine Donation Program. They coordinate the donation of the medicines. So some from GSK, and then the MEC, they give us these medicines. So what's the nature of the program? You go, and when do you start? You go out there and you call people to just come around for drugs, or I mean, how is it going to be like? And is there an opportunity for you to give our viewers, any information that they should be aware of? Yes, what we do is that every year before the start of the program, we do a national training of trainers where regional directors and other technical officers are brought together. We go through trainings and the kind of things that we need to do. Then they go back to train districts. And after the district training, they train the volunteers. So now we are done with the national training, we are done with the regional level trainings, and districts are doing their trainings. They are training the volunteers now. So they are getting ready. Social mobilization is ongoing. So from next week and then up till the 5th of June, treatment will be going on, and then we expect everybody to participate, because you never know which mosquito is biting you next time. And it is the very Anopheles mosquito that gives us malaria that also transmits this elephantiasis. And we are all at risk, and these medicines are not sold to us, though they are very expensive. The Metizan, a tablet from the point of production, is $1.50. So if you are taking 4 tablets, yours is $6, and that is the cost over there. It comes by air, and every other cost you add extra cost is so huge. And the volunteers sacrifice their work and everything to move to your house to give you the medicine. So people should make themselves available. Yes, unfortunately, things that come to us for free, that we are not paying for directly, we don't appreciate. But you can save the trauma, the agony that patients of these diseases go through. You can imagine you going blind. By onco blindness is irreversible. So you get blind. Nothing can be done. Nothing can be done. Right. So you want to make yourself available when they come around to give you these drugs, because then it will help you. I think that maybe you should be a bit sensational. Maybe send some sensational pictures. Usually people get scared because they see, they see what the disease can do to you, and then they'll be compelled to stick around. Yes. The biggest problem with some of these diseases is that risk perception is low. Not that people haven't seen those that are suffering them. Elephantiasis, people have seen others, but they don't think that they can get it. Not a lot of people have seen others, yes, and even when they see, they don't believe that it will happen to them. Well, it can happen to you. Exactly. It can happen to you. It can happen to you. So make yourself available for the vaccination. So when are you starting again? Yes, so treatment is starting from next week Monday. Next week Monday. Yes, so up till the 5th of June, districts will be treating. So anybody that lives in any of these 125 districts, there are many, so I can't mention them all here. Yes, but they make announcements, and the vans go around announcing for people to know. So people that live in these districts are aware that some of these things do happen.
So they're starting next Monday. Where are you starting with? At least we can.
All the districts
are starting at once.
Yes, so we are done with a lot of things. So
well, so you have to just look out for the team from the Ghana Health Service. They'll be coming around with this vaccination or this treatment, or these pills that you take, and then it gets you treated of river blindness as well as elephantiasis. Like he's saying, don't think you can't get it. As for sickness or diseases, it gets to everyone. So you want to be ready for that. So your final words. Are you using social media? By the way, it's almost everybody seems to be on there.
Yes.
You're using it?
Yes,
so how can people get in touch on social media? Maybe if they have questions, if they want to find out when you're coming to my district, etc.
Well, various platforms are available in the various districts, but at the national level too, we are putting something out there. Anybody can also. My name, I'm Bright Alomatu. If you you can get me on Facebook. Whatever, and I think if there's any question, I can.
Okay, Mr. Alomatu, thank you very much for coming through to the studio. And they're not big pills anyway, very tiny ones, so don't be very bothered. Right, Alomatu is the chief biomedical scientist, and they'll be going around looking to treat or give you pills that treat river blindness and elephantiasis. We're still